Hey, it's Dr. Beavers again. Today I'm going to cover a group of bioregulators that I always get asked about, and that's PNs, PDRNs, and sodium DNA. They're new terms for many and they have closely related names, so as you can imagine, this leads to a lot of confusion and lumping them together when they're actually pretty different in what they do, and they're significantly different in their cost. When your skin is stressed, aging, inflamed, dehydrated, or sun damaged, it runs low on raw materials it needs for repair. One of those materials is fragments of DNA. PNs, PDRN, and sodium DNA are simply all little fragments of DNA, but where they differ is in how long each of them is. PNs, short for polynucleotides, are long chains of DNA fragments that act like superhydrators. They pull moisture into the skin, improve elasticity, and give that bouncy, glowing look. They're available in the UK, but not in the US. PDRNs, short for polydeoxyribonucleotides, are very short DNA fragments that help with severe cases of acne scarring, photoaging, chronic inflammation, and healing from aggressive procedures. Because they're short and all the same length, PDRNs can fit like a key into a lock to activate a receptor in the skin called A2A, which calms inflammation, improves circulation, and speeds up repair. One brand in the US is called Regeran. In the US, most PDRN treatments will add $300 to $700 per treatment onto the cost of whatever procedure is being done. Sodium DNA is not a combination of PDRNs and PNs, but it sits right in the middle. It gives your skin more structure via collagen stimulation than PNs, more overall rejuvenation than PDRN, but it doesn't activate the receptors like PDRN does, and it doesn't hydrate as powerfully as PNs do. So think of sodium DNA as the ingredient that strengthens and rebuilds. It helps with collagen, firmness, texture, and skin resilience. Some brands in the US are Toscani, Vamp, and Promo Italia. In the US, most sodium DNA treatments will add $150 to $300 per treatment onto the cost of whatever treatment is being done. When it comes to concentrations of sodium DNA and PDRN, 1% or 10,000 parts per million is the minimum for collagen stimulation, but 2,000 to 5,000 parts per million, which is commonly found in some topical skincare products, can still help with hydration, redness, and barrier repair. PDRN and sodium DNA are too big to get very far into the skin topically, so their effects are more limited. They need a route to get in, like microneedling, peels, ultrasound, or laser. At Live Without Lines, we use a 3% or 30,000 part per million product called Lumicin from Toscani. We use it with some unique protocols we designed, and we're seeing results similar to RF microneedling, but without all the pain and torture that comes with it. And it's a lot cheaper than RF microneedling too. I hope this enlightens you and clears up any confusion in the terminology. If you have any questions, please comment or reach out to us.